We're broadcasting on Periscope. Hello there, YouTube. Thanks for joining in. This is Mary, and we're doing a facelift under local anesthesia. We're also doing some facial filler. Mary, how are you feeling today?
I'm doing okay.
There you go. She's had a little bit of the relaxing medicine, so it's like you had a few cocktails,
yes.
Right? So Mary wanted to do some tightening. I'm going to show you her pictures of her neck and her jawline here, and so she's got some volume loss. We're going to do some fillers. Now we don't go from A to Z. We're going to try and get as much improvement as we can with one treatment. So today we're going to do the fillers. We marked out these areas. Mary, make a big smile for me and see how good that looks. Now relax your face as best you can. So I'm going to do some numbing medicine through these areas, and I'm also going to be doing some cleanse. So my name is Dr. Rich Castellano. I'm a double board certified facial plastic and reconstructive surgeon. I've done over 3,500 facelifts under local anesthesia. You can look us up at ImageLift.com. I've done over 5,000 syringes of the Bellafill long-term filler injection. Many people consider it to be permanent, as do I. And so look us up at ImageLift.com. You can find us on Amazon.com, 2 Wall Street Journal best-selling books. Also, look us up on YouTube. We're streaming live on YouTube, and please do like our YouTube channel. We've got more videos coming for you. So the goal here is to show how we do facial fillers and how you build the volume without looking unnatural. You must look natural. So what I'm going to do is I'll use some of the numbing medicine, and I use this little buzzer device, this little egg-shaped buzzer, and so we use 1% lidocaine with 1 to 100,000 epinephrine, so the little injection, and then we buzz on the cheek. And Mary, you'll feel a pinch. 1, 2, 3, pinch. You feel a little pinch there? Mm-hmm. Not too bad?
Not bad.
Okay. You feel a buzz and a pinch. 1, 2, 3, pinch. It's a little more tender there.
Yeah.
1, 2, 3, pinch. So we'll do a little bit more numbing. Now I'm not in a hurry. I tell everyone if they need a break, you let me know. How are you doing, Mary?
Okay.
So I'm just numbing the tissues.
Okay.
People ask how long does the filler last? Generally, the Bellafill is 80% collagen, 20% PMMA. The collagen gets absorbed. The PMMA is non-absorbable. If you read the FDA approval, it's going to stay with you. They did a 5-year study, but the filler does last beyond that. And so, thank you for the comments. Thank you for the questions. You'll feel, and I'm going to turn your head a little bit this way. Buzz and then pinch. Can you look at the comments, Nina?
Sure.
Sorry there. Give you a little break. You doing okay?
Yep, okay.
Big deep breath in and out. Now you feel buzz and then pinch. 1, 2, 3, pinch.
I said hello, Mary and Doctor.
Thank you for joining in. Hello, Ray. Hello, Scott. Good to see you. Buzz and pinch. 1, 2, 3, pinch. Everything's looking good. Mary, how you feeling, dear?
All right.
Someone said interesting. Not sure if she can watch.
Pinch.
Yeah.
So thank you very much. Lots of likes and shares. 1, 2, 3, pinch. For Mary, thank you for allowing us to do some teaching while we do your procedure. We've had little pinch. We've had hundreds of thousands. Sorry, that's a little more tender.
Someone said I love these broadcasts.
Oh, thank you for watching. So we don't expect to 100% correct. The goal is to make it better and prevent things from getting worse. So now that we've done some of those areas, then what we do is
Mary's tough.
Do you feel a little bit of a pinch here, Mary? Little pinch?
Yeah.
And you feel a pinch here. 1, 2, 3, pinch.
Someone said they have a crease in between their eyes that they'd like to fix.
We can do that for you. We can help you with that. There are 3 general questions with the filler. The first question is, where do you want the filler? And we've marked out on the face where Mary's going to do the filler today. The second question, which filler? Do you feel a little pinch here? Yeah, so she can feel like it.
Someone asked if we could do more broadcasts.
Yes, we're working on that right now. Sorry, that one's a tender spot.
That was a tender spot.
Now, how about right now? Are you feeling any pain at all?
No.
It looks scary.
So we did the pinches, and now after that, she's pretty numb, and she'll feel she'll feel a little bit of pinching, but at this point, she should not feel too much. So what I do is I use a little tiny needle. Now, can you feel a little bit of a pinch here? Little pinch?
A little bit.
So she feels a little, and that's the entry point that I'm going to put the cannula. Okay, so what I do is with the cannula, hello Terry, good to see you. That's the cannula, it's a blunt tip. okay? And it's less traumatic, less bruising. So then what I do is I insert the cannula. Mary, I'm going to turn your head a little bit this way. That's perfect. And then I thread that cannula through. I use this little twisting motion to just thread the cannula.
Someone
So you
asked if
feel
you're diabetic. Does it
pressure
matter?
pinch, pressure pinch. Anyone who has diabetes has a little higher risk of infection, but I still have many of my patients that have diabetes and they do well. Mary, do you feel a little bit of a pinch there?
Yeah.
Big pinch,
Yeah.
little pinch, medium.
Just a little pinch
Little
there.
pinch, okay. So you notice I use a little bit of a shiver technique, and the reason why is because I want to spread that product very fine amounts over the area. So that's the shiver technique that I use. Go ahead.
Someone said yikes.
How about now? Little pinch there,
A
Mary?
little pinch, but
Okay. So at this point, she'll feel little pinches. They're very tolerable. You can see she's not jumping out of the chair.
Not like you.
Mary, why was it that you wanted to do a cosmetic treatment, dear?
I just want to look a little younger, get rid of all that
There we go.
whiskers.
Well, we're gonna do the
wrinkles and
we're gonna do the fillers, and we're doing the tuck for her as well. We're doing the ImageLift with the laser lipolysis.
Someone said it looks like it's going very deep.
I'm going right on top, right subcutaneous, and some of these I can go right above the periosteum, supraperiosteal.
They said, you go, Mary. How long is
Looking
her
good.
procedure going to be?
The fillers are going to take me about 20 minutes to do, 20-30 minutes, and then the lift will take me a couple of hours.
Can you fill the crease even though it's about half an inch?
Right, so I'm going to fill it as much as possible, but the lift is also going to give us some help with that, as you can see. So, hello, Kalia. Thank you for joining in.
Why is there no blood?
Well, she's got a really good injector. That's the main reason why there's no blood. And if you know the correct planes, there's really not much bleeding to speak of with the fillers. So after doing one syringe, as I tell patients, you don't want to taste the chocolate cake before it's done baking. What I did primarily is we outlined across the top of the cheek. Make a big smile for me. Big smile. Now relax as best you can. So you can, let me turn your head all the way this way so you can see the outline of her arch here. I'm going to do a little bit more filler in these areas, and we're also doing some of the lift as well to bring that back, so that'll be the combination between the
What
two.
is
But
the
you can
injector?
see that's Dr. Rich Castellano is the injector. That's me. You can see that she still looks natural. She passed the grocery store test with that. I'm going to turn your head all the way this way. Okay, now we're going to do a little bit on this side. Mary, how you feeling, dear?
I'm okay.
Very good.
Yes, all right.
And I'm going to turn your head.
Nothing's hurting right
Okay,
now.
good, good. How about here? Do you feel a little bit of a pinch?
Yeah, a little bit.
So she feel a little pinch, but I put that little insertion point
What a
through there.
difference.
So not like the first time. you
The
feel
first time
pinch.
it's more tender
Feel
with the
pinch.
numbing meds.
Yeah, right.
Please do make sure you're following us on YouTube. Go to youtube.com/ImageLift.
Will there be any swelling?
Yes, she will have some swelling. Usually with fillers, there's no physical downtime. There may be some bruising, that you can have a bruise for 4 to 7 days, but some people have no bruising. It depends if they're on blood thinners or the medical history. So now I'm feeling with my finger here as I'm injecting, and you can see the cannula and the syringe is there. And this is a fanning technique, and I'm doing very small amounts. So right now it's at 0.6, and so I'm injecting. And
It's a great job, Mary. You're doing
now it's at 0.5. So you can see the amount that I'm doing. That's 1/10 of a cc. Now it's at 0.4. We're just slowly injecting the whole syringe in and spreading it as far as we can all around these areas. She will absolutely not overcorrect with what we're doing now at 0.3. That's across the zygomatic arch.
great. Someone said that like the no downtime results.
Yes. Now we will be doing the lift. That does have some downtime with the lift.
What are fillers made of?
The fillers are made up of collagen and PMMA, that's polymethyl methacrylate. That's a substance used for heart valves. It's also used for bone cement and for intraocular lens. So it's very stable, and it's FDA approved for use in the nasolabial folds and acne scarring, and has a 5-year indication, but I've seen patient results for 10 years with good results, good longevity, looking natural.
Someone said thank you for broadcasting. I'm really going to consider this now.
Thank you for looking. Yeah, it's hard to see injecting on that side. I'm going to go back over to this side here, and I'm going to do a little bit of injecting over here. And thank you very much to my team. Charlene and Nina are here.
You got it.
To help set everything up. Now I'm using the needle injection in the skin. Now, do you feel a little bit of a pinch right in through here?
A little bit. Mm-hmm.
So now I'm injecting in the thickness of the skin.
Mm-hmm.
And when I pull back, the combination of the two will help her out quite a bit. So this side is easier to see with the injections. So it helps some, but without the lift, it's not going to make as much of a difference.
Does it stay for life?
The collagen is absorbed and replaced by our body's own collagen, but the PMMA is non-absorbable. If you read the FDA approval, you can see that you feel a little pinch here, a little pinch.
Mm-hmm. Yep.
So we're filling out those areas, and I like to do a firm massage. Everything's looking good. Now you'll notice once you go into the dermis, some of that can spread through the dermis a little bit. Yes, you can use hyaluronic acid through a cannula. So the goal is to thicken the skin, a little pinch through these areas, because she's had some atrophy of the skin. In combination with the lift, it will really help out those creases. So I like what I see so far. Now it's just a matter of little pinpoint treatments. I'm going to do a little bit on the other side as well. Very good. Thank you for watching. We will be rebroadcasting later, so make sure you're following on YouTube, imagelift.com/YouTube. We will be broadcasting there as well. Pinch. You feel a little pinch there or not really?
Not really.
Me neither. Just kidding with you. Everything's
Someone said
looking
hello.
good. Hello, thank you for joining in. Hi, Josie, thanks for joining. So this filler is going to work best in the nasolabial folds in combination with the lift, so we're thickening the skin. But I like to do the fillers first and then follow up with the lift after. So let me turn your head this way. Now notice through here, if I just get a little bit into the dermis, I can start injecting there just a little aliquot and then spread, because it's kind of, it reinflates between the dermis and the epidermis. Intradermal, I think, is probably more accurate. Little pinch. And you can do little spot treatments as well.
Is she having a
Yes,
partial
we're going
facelift?
to be doing the lift as well, the ImageLift. It's not a full traditional facelift, but it is a very complete treatment of the neck and jawline with the lift that still looks natural. Now I'm going to make a little insertion point. Do you feel a pinch over here or not really?
Not really.
I'm going to
right
do
there.
some fillers in the brow as well, because when you do fillers in the brow, the bony prominences of the face, they fade away over time. And so I'm going to make a little insertion point right here.
Has Mary had any previous work done on her face?
No.
Nope. Thank you for asking. Thank you for the comments. Thank you for the shares. Hello, Shannon. Thanks for joining in. We will be rebroadcasting, so make sure you're following, and please do share with your friends. So I made the little insertion point, and sometimes I'll make it more than once. There we go. So you'll feel a little pinch through here, and I do the twist technique to get it through the tissues. Little pressure, little pinch, little pressure, little pinch. And I'll use 0.2 to 0.3 cc's. I do mix some of my Bellafill with some lidocaine to reduce the viscosity. I like the way that it injects better there. So just a small amount, not too much. So just a little through there, and I'm going to do a little on the other side
Is
as
she
well.
suffering?
She said suffering. Are you feeling any pain at all right now, Mary?
No.
No. Okay, let me turn your head this way.
Feels numb.
Yep. With the fillers, what you tend to feel is you feel pinching from the numbness, and then afterwards you might feel a little pinch here and there, but it's very tolerable. It's like going to the dentist. Little pressure, little pinch, little pressure, little pinch.
Right.
She's fine.
You can see the
obviously.
cannula
she's
right
on
there.
to
You
the
see the
other
cannula. Okay.
one.
Thank
Love
you,
watching you use
Shannon.
Bellafill. Can't wait for her results.
Yep. Everything's looking good. So I
Robin
use about
joined.
0.2 to 0.3. Say that again.
Robin joined.
Hello, Robin. Thanks for joining in. We had a good time at your event the other day out in Sun City. Okay, everything's looking good. So we're doing a little bit of Bellafill. For those of you just joining in, I'm Dr. Rich Castellano. What is TB?
To be honest.
To be honest, okay. Right, so the fillers are a part of what we're going to be doing for her. Now,
Is she doing a lift as well?
we are going to be doing the lift next. So, for those of you just joining in, I'm Dr. Rich. Can you join those together? Rich
Okay,
Castellano.
this is the fillers.
Double
Okay.
board
Yes.
certified. This is the fillers. Let me turn your head this way just a little bit. So I'm going to fill a little bit through these areas as well, just to kind of some diffuse volume.
What is this filler and what is it made of?
Bellafill is made up of 80% collagen and 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen, and the PMMA is non-absorbable. So I'm just putting a little bit through here. I've just put about 0.15, 0.2 cc's down. You can place the product diffusely and you'll still get a very good result. You're just helping build up some of the volume. If we're lucky, aging keeps coming and we know we're going to lose some of the volume. Very good. Thank you for tuning in. Thank you for the hearts and shares. Please do follow us on youtube.com/ImageLift. We will be broadcasting more there.
Where do they get collagen from?
It's a bovine source that's raised in the United States. Mary, how you doing, dear?
Hey.
Does
Okay.
this give you a better result than doing the lift only?
Yes, there's 4 categories we address to help people look younger. If we sag, then we tighten. If we lose volume, then we fill. If we get sun damage to the skin, wrinkles, and sunspots, we can polish and repair the skin. Let me turn your head this way. And the 4th category outshines everything else. That's our behavior. And none of our treatments look as good as when we put a smile on our face. And Mary knows the power of smile.
Do you do liposuction?
Yeah, for the face and neck only. When you're doing the lift, if you pull really, really tight, sometimes you get a little tightening in the tummy. I'm just kidding. But we only focus on the face. Now, Mary, you had a chance to read our book.
Mhm.
What did you think about our book?
Well, the book is very interesting. It tells you all the steps and all the different people that have done it, gone through, and it's real informative.
Good. I'm
Yeah,
glad that was a
read
good
it.
resource for you. And so, you came to one of our seminars?
Yes, I did.
Perfect.
Mm-hmm.
And we have our patients that come out there, people that have done the treatments. We show before and after pictures.
Is this the
Mhm.
permanent injections?
This is the long-term filler. It is not absorbed by the body. Okay.
How can they contact you?
ImageLift.com, and our phone number is 813-463-9245. So make a big smile for me. Big smile, big smile. Now relax as best you can. Okay, good. So you can see she's getting a little bit more volume through here, and it's,
Amazing.
yeah, some people, they don't like to watch these types of treatments. Let me turn your head this way a little bit. And I can understand if you are not, this is something you don't want to watch, but the goal is to teach people what your options are, how to look natural, how to choose the right doctor. I've done over 5,000 syringes of the Bellafill. I'm the #1 Bellafill injector in the United States. And we do a lot of this product. We've got a lot of happy patients. When you use the filler, most people feel it and say it feels very smooth. They don't feel anything. Some say, well, I do feel something, but they don't see it, and you leave it alone. It's very rare that you have to excise a nodule. But what I do is I use a technique where I use a small amount over a large area, and I have a few medicines that I can use to soften nodules, massage, and that way it feels very smooth once you're done with the treatment. That's the typical experience for patients. So
How-
you can treat nodules.
Sorry. How long until you need another session?
Well, the product stays with you, but our bodies go through growth spurts and aging spurts. It's like getting 5 years or 50,000 miles out of our tires. It depends on how you drive your car. Let me turn your head this way. Very good. Everything's looking good. So I'm doing just a little bit more. We're wrapping up. I did a little extra in the cheeks just to build up that volume, but I'm going to show you again her pictures, and then we're going to start the lift here in just a little bit.
Do you do your own surgery
Well,
on
I
yourself?
do my own fillers. I like my technique, but not surgery on self. So I do cut my own toenails and fingernails, though. But thank you for asking. And so I like my technique, so I do my own fillers.
God
Thank you
bless
for
you.
tuning in. Please follow us on YouTube. Please share. If you're watching live procedures and you tell your friends and you didn't share with them, they're going to be upset. So follow us on Periscope. It's at Rich Castellano.
Hello from
We're on
France.
Facebook. Bonjour from France. Let us know where you're tuning in from,
Middle East, Saudi Arabia.
and if you have a medical background. Okay, so we are wrapping up with the long-term filler. So we did 6 syringes there. We did some in the brow, a lot in the cheek, around the smile lines. Now, I'm going to turn your head this way, and you take a look, and you see her now. This to you. So that's Mary in the after. Make a big smile for me, Mary. Big smile. And then now look and see where she started. You can see the flatness on the cheeks and how it's really filled. I'm glad you like them. Thank you very much. And then you see how much fullness she's got. And she looks natural. If we stopped right now, she would pass the grocery store test. So thank you, everyone, for tuning in. We'll have more to come soon. We're going to do her lift next. You did great. Congratulations, Mary. And let me zoom out here. Thank you, everyone, for tuning in. I'm Dr. Rich Castellano, and we'll see you soon.
Yes. On YouTube, is that what you're doing?
Uh-huh.